Chapter 3, the Childbearing and Child-Rearing Family. Family-centered care is exactly what it says. We are providing care to the whole family. When we talk pediatrics, you must include parent or caregiver into the education process. We need to empower the family to help them care for our patients. OB and Peds are revolved around family-centered care. We start off by finding out who is considered family and helping in this family. We could have a single mom who works 2 jobs to make ends meet, so the aunt provides a lot of care to the family. The aunt needs to be included in the process. We can't only think about the patient. You must consider all people involved. Characteristics of a healthy family include good communication, flexible and able to adapt are a few ways. The healthy family can adapt to change. These changes can be birth, premature birth, injury to a family member, ill children, etc. There can be various factors that can interfere with how a family functions during the time of stress. Divorce can affect children and the parents involved. As a nurse, we can help by letting children talk about divorce. They can use therapeutic play to help see how the child is coping. Another factor is the adolescent parent. Not all adolescents are a bad parent. They are at risk for more pregnancy complications, as many times they do not have the support they need and they do not seek prenatal care. Many may not be able to drive yet, so transportation can be an issue. Adolescents may not be meeting their own nutritional requirements, and now being pregnant puts even more risk for nutritional deficits. Violence is a huge stressor for everyone involved. Abuse can be physical, sexual, emotional, or neglect. We will talk about these more in depth in the upcoming weeks. Parents who have a substance abuse problem may be neglecting their children's needs, and they may put their own needs first. Or maybe it's a child is the only one with substance abuse problems. This causes stress for parents and other family members. A child that has special needs can put a lot of stress on families. Many times they can be a financial burden. Many times a parent may have to quit their job, or they can care for the child, or just they have time so they have time to take the child to the various appointments. It can be very hard on a marriage, and this is an added stress as well. One thing we need to remember as nurses is not everyone handles stress the same way. Remember, family-centered care involves caring for all members. If you have an ill child in the peds unit whose parents are going through a divorce, the parents may not be making that child a priority. Not that we can solve all the world's problems and make the divorce any easier, but that parent is not going to be able to care for the child if they are not emotionally stable. Helping to find available resources is one of the things that we can do to help the family. Most families can have dysfunctional periods. Dysfunctional families are ones who just never seem to get along with others or never be able to handle the stress. Many times they do not have the support, and many do not know how to communicate effectively to help them get through the stressful times. As nurses, we can help families cope with the stress by helping them identify their strengths and weaknesses. We want them to utilize those strengths to help the situation. Box 3.1 goes over examples of internal and external strategies. You will learn about culture in every course you take. We can't possibly know about every culture, so knowing some general aspects of their culture can help. We want to provide the best care for them and respect their beliefs. Also, remember that just because someone is of Hispanic descent doesn't mean they follow all of their beliefs. Ask your patient so that you can provide the best care for them. I'm going to provide a few basic examples that can influence our nursing care. Asian and Pacific Islanders, for them, family is highly valued, and many times multiple generations are present. They want to be respectful, so they will accept a prescription, but they may never get it filled or take it. Many times they do not understand English very well, so they tend to answer yes for everything, so avoid yes or no questions. Hispanics, men are usually the head of the household and make most of the decisions. They have a close extended family, and high value is put on the children. They like to have small talk before presenting a problem. Religion and health is very important, and they may use a folk healer. African American, they often are part of a close extended family. They have a sense of loyalty. Religious is important, and many times prayer is used. They may see illness as a will of God. Middle Easterners, the men are typical head of the household. Islams include prayer 5 times a day, so to be sure to ask about this so you are not interrupting. Muslims do not eat pork and sometimes other meats. Muslim women prefer a female provider, and many keep their heads, arms, and legs covered, so be respectful of this. Obtaining health history can be difficult as they believe this is private information. Be sure to obtain a thorough culture history from your patients. Be sure to ask about their customs and beliefs. Ask about medication. Many will not consider their herbal folk treatments as medication, so you have to specifically ask about those as well. Ask about health promotion measures and how you can be as helpful to them as possible. Dealing with a misbehavior is not an easy thing for parents. They may turn to you for advice or suggestions. Many times you may see parental behavior that is not effective or helpful, so we must role model what is correct. Discipline strategies can vary between children and between ages. What works for one child may not work for another. Having the parents be consistent is the number one thing they can do. There are a few suggestions listed in your book regarding ways for discipline. Redirection is one. This is where you just redirect the child away from the behavior they are doing to something else. This works best for the infant through the pre-adolescent. Reasoning is where you tell why that behavior is not acceptable and what will happen if they continue the behavior. This will work only once a child understands, so probably about age 4 and older. If they are given the consequences, the parent must follow through, or it's just an idle threat and the child learns that very quickly. Use of timeout could be effective as well. The general rule is 1 minute per age they are. Using a special chair and a special spot can help, and using a timer so the child knows to sit quietly until the timer goes off.